Thank you very much, Dr. Miller. First and foremost, I want to thank Dr. Miller for this invitation and her team for helping to facilitate this webinar this morning. My goal today is basically to help provide some resources and strategies for students with disabilities, and particularly those in a virtual learning environment. I would be remiss not to bring up the fact that all of our lives have been disrupted over the past year, and we've all had to learn to adapt and adjust to this new environment. And just as we're learning to adapt, it is also a period of adaptation and change for our students and children, particularly when it comes to learning virtually. So the purpose and the focus of my lecture today basically is to try to provide again some practical tips, and some of them you're already familiar with, but again it's just to mainly reinforce some resources or tips that can be used to help our children or our students to better adapt to these changes, particularly when they're learning virtually. So my main objectives today are as follows. So essentially, this webinar will provide different strategies to promote health and wellness while learning in a virtual environment. We will discuss the different strategies to keep children healthy while learning from home. And finally, I will demonstrate the benefits of nutrition and exercise to promote wellness. So for me, and when I was working on putting together these slides, I kind of categorize, I guess I'll say like 3 cornerstones for health and wellness for our children with disabilities. The first one is focused more on individuality. It is extremely important from my perspective that we focus on each child individually. And I'll go into each one of these in much more depth throughout the upcoming slides. Physical activity is key in many instances, and we'll notice how they affect several aspects of our students and children's lives. And again, it's just an idea. The idea is to reinforce what we can do and how we can actually engage our students and or children basically in physical activities that will help them thrive throughout this times that we're all again experiencing now. And finally, the third aspect of my presentation today will focus on nutrition. And nutrition, I know many times we hear about nutrition and the importance of us eating well, but it is most certainly important for our children to grow and develop and thrive in their environment. So again, that's another aspect that I'll discuss with you and explain to you why certain types of, I guess, diets are better for certain types of disabilities, and others are, again, and while others are better for other types of disabilities. So I'll go over these again in much more detail as I go over my slides. Students with physical disability. So there are obviously varied causes and degrees of physical disability. And again, you'll hear me kind of repeat a lot of the first 3 cornerstones that I've identified. And these here, or this particular slide, will focus a lot on individuality. So again, because each child is very different in terms of their physical disabilities or disabilities overall, it's important for us to really treat each one of them according to their own needs and in their, I guess, their own wants in a ways, in their needs or needs that are specific to them. It's important to always consider the ability level of each individual student. Again, there may be 2 students with similar disabilities. However, they are very different because they're individuals and they have their own temperament, their own characteristics. So it's really important for us to, again, not have a one size fits all type of approach to our students, but to really approach each one of them as the individuals that they are and cater basically to their needs, their individual needs specifically. Students may have none of the same characteristics as other students, which is essentially what I've said. Again, and the next point here is similar disabilities does not mean that two individuals are the same. So again, these all are stressing the idea that individuality is really important. And in healthcare overall, actually, there's been a shift over the past decade or so where the focus the focus is usually on instead of having a cookie cutter approach to everyone, let's say, who has a cold, this is what we're going to do. There, we're looking more and more at the individual patient and catering to their specific needs at that specific time. So essentially, this is what the focus. One of the focuses of my slides is to, I guess, drive home this point that each student is an individual and they should be approached as such. And of course, I'll talk when we're talking about physical disability specifically. We need to keep in mind that there are, each student or each child may have certain allergies. So as I go over other I guess certain specific physical activities that we can use to engage them, there are certain things to keep in mind. Allergies to certain materials such as latex, and I'll go over that with you a little bit later. However, not only just allergies to materials, but also allergies to foods and other, other environmental factors that, that each child may come into contact with. So be mindful of those as you're engaging with them. So there are certain areas to watch. Again, because this has been a very new environment for all of us to adapt and adjust to, just think of it, with us as adults, we're still learning to adapt to this new environment. And we're at a point right now where everybody's kind of like tired of this way of living. So again, just as it has been disruptive to us, and we're learning to adapt to this new environment, it is just as disruptive to our students and children. So there are certain cues to look for, and when you take notice of them, please, essentially what I'm asking is for you to take notice of them or even possibly keep a record to see if there have been some changes over time. And that's their way, that's the children's way of expressing to us or communicating to us that there's something that's, that's different for them and that they're learning to adapt to. So for instance, if they're acting differently, their basic skills or abilities have changed. In the very beginning, you may not necessarily notice it. You may think it's just a 1 day off, they're having a day off that for one particular day. However, it's really important that you take note. And like I said, keep a record loose, like not anything formal, but just at least keep watch and make, ensuring that anything that you observe that's different, take note of it and possibly share with, if you're a teacher, share it with the parents. And if you're a parent, possibly, always keep in touch with the teachers and find out if there have been any noted changes in your children's lives or behavior. If the child or children are unwilling to take part in routine tasks, again, if that wasn't an issue before and it's becoming an issue, it's something to look out for. Significant changes in sleep patterns or appetites. So again, maybe they used to sleep, I don't know, maybe 5 hours or 6 hours, or hopefully much longer than that. But let's say there are noted changes in how long they're sleeping. Maybe they're not sleeping as many hours as they used to, or they're sleeping a lot more than they used to. So these again are patterns to look at. And appetite would be similar. Are they eating as well as they used to? Are they eating less? Or again, are they eating more? Or are there certain types of food that, suddenly they're not really, that they have no interest anymore in having? So, and another, yeah, I guess some other areas to watch for is whether there's frustration. Again, all of these are not what you would typically see of those students. However, if there's a notable difference in, in their level of frustration, or there's more aggression, and they're displaying more aggression or anger, more anxiety or sadness. Uh, Again, these are certain areas to take note of and start noticing what's going on with them, because again, sometimes they may not necessarily be able to communicate to us um, clearly, I guess, what they're feeling, but through these changes, again, that's how we'll pick up on something going on with them. Insomnia, are they not sleeping at all? Yeah, or their ability to fall asleep, is has changed. They may have tummy aches, constipation, or other physical issues as well. But what's most important with these changes, or are if there are no medical explanation for these again changes that they're experiencing. If it's something that's normal to them, they're kind of going on, with their normal day-to-day activities before all, this virtual learning environment, then that's fine. But if it's something that, again, you're noting changes that are significantly different than what they were before, or that there are no medical explanation for, please again take notice of those. And again, it's important for you to form a community between teachers and parents and other caregivers, to communicate amongst yourself and putting together some of and discussing, I should say, some of the changes that you've noticed in those students, and so that again you can get them the appropriate care that they need. Also, they may have quick bursts of energy. If they're facing a lot, back and forth, and again, they're not, it's not normal for them, or, their normal behavior. Tantrums, much more than before, or maybe they didn't really have much, too many tantrums before, but now they're starting to have more of them. And also, if they're becoming a lot more vocal than they used to be, that's also another change that it's important for you to take note of. Exaggerated, challenging behaviors more than normal. Again, that's what I've been stressing over the past, I guess, couple of slides here. That when anything that you're noticing that is out of the, I guess, ordinary for those students or for your children, it's really important for you to take note of them, and again, discuss them among the caregivers and parents and teachers, so that you all can, I guess, figure out whether, again, there's been some major changes in these children's lives. Here, distractions, those actually are even for students without disabilities, and even for us generally. Uh, Again, when there are, again, there's a new environment that we're all living in and we're all adapting to. And particularly when it comes to learning virtually, the focus is something that's extremely important. So I would recommend that you limit distractions and try to, again, try to engage them in being more focused in learning, again, virtually. It is a challenge for many, and for our students who have certain disabilities. It's important to make sure that you limit any distractions that could potentially take their focus away from learning. Frustration and stress. Again, because it's a new environment, there's not much face-to-face, at least physical presence there, face-to-face, in terms of the children learning. It's important, again, to take note of any type of frustration that they're expressing, or possibly stress. Isolation. Um, Again, I'll go back to our own experience throughout this past year. again, it has been a challenge for many adults, just in general, feeling, isolated and, essentially trying to keep um, active and social with other people in their environment. So as much as you can, try to, if you notice that they're going off, and staying on their own, try it again to keep them engaged, give them, be there for them, and notice if if there's a sense of isolation or they're kind of staying off to the side. Try to get them to focus more and engage again in different activities, as they're learning, from as they're learning virtually. So diminished social aspects, another area to watch for. Again, they've had a routine prior to all of these changes. They're seeing other people, that, on a day-to-day basis, likely that that they were exposed to. And, of course, all of a sudden in a virtual learning environment, they may not see other people or other children that they would see on a daily basis. So again, this kind of goes hand in hand with isolation. So let's make sure, again, that we can use, and there's a slide coming up regarding that, but essentially that you're using the computer or your phones through Skype, maybe engage them with other children or families and friends that they can keep in touch with and actually, again, engage with virtually. There may be a lack of motivation where they may not feel like doing very much. But again, that's where a lot of the physical activities will come in. Hopefully, again, as I discuss this a little bit later, we'll talk about different ways, again, to get them focused and engaged, and feeling that they're well supported and not, again, living either in a silo or that they're off, on their own somewhere. Time management. Time management is extremely important. Uh, as you're all probably familiar with, it's really important to keep a routine and consistency in children's lives. If you have, let's say, at 9 o'clock in the morning, it's time for them to learn, and to basically you're setting up the computer, and you're getting them to engage again with teachers. Basically, make sure that I think I said 8 or 9 o'clock, but whatever time it is, make sure that you keep there's consistency every day at the same time, making sure that they're learning and that they're engaged with their teachers. If, for instance, there's lunchtime, obviously, for lunch, if it's at 11 o'clock, make sure that, again, lunch is provided at 11 o'clock. Really keeping a routine and keeping some semblance, obviously, of consistency will really help them to thrive and grow, and help them to manage, again, these changes in a more beneficial way. So what are some solutions? There are many, but essentially keeping your children active, keeping the students active is essential. Again, once they're active, you're keeping their brains engaged, they're engaged socially. When I say socially, at least with their parent, if obviously if they're home, or possibly in other siblings. So keeping them active, there are many ways that can be done, and I'll discuss them a little bit later. Help children stay socially connected. I touched on this just a moment ago. Essentially, again, whether it's through Skype or FaceTime or Zoom, stay connected, help them stay connected. Maybe it's with other children that they would go to school with prior to changing to a virtual learning environment. It could be their grandparents or siblings, maybe older siblings that are no longer maybe living in the household. Just keep them engaged. Use these technologies essentially to help keep all of them, each child engaged socially with others. help children cope with stress. I also mentioned that earlier. And again, you will notice again, physical activity has a lot to do, it can do a lot to help with coping with stress and many of these other, um, I guess, many other areas, again, that may have become a challenge over the past year as they're learning to adapt to learning virtually. Parent collaboration, obviously, if it's two, parent household, the child seeing that everybody's working together and then engaging them and basically that will help them because again, it shows some level of, consistency in their lives. If it's a one parent household, then my recommendation would be, of course, keep, as a parent, it's important for you to keep to be engaged with other parents. It can be also obviously via social media, but be in touch with other parents that have students that have children with disabilities, and kind of have an outlet for you to find out, I guess to discuss some tips and other resources that other parents are using that may also help this be a little bit easier on you as a parent. And the reason for that is obviously children take notice of any changes in adults, their parents, teachers, or anyone that's around them and their caregivers. So if you're feeling stressed, they'll pick up on that. And our goal is essentially to help them thrive throughout, again, this a major change or disruption in their life. Internet safety, obviously, let's make sure, whether it's the news, particularly if it's the news, let's say, you have the internet on and on a page where there's news and there are all sorts of violent scenes that they can have access to. Just make sure, of course, there are parental control settings that you can use to ensure that that you're comfortable with what they could potentially see. But also, if you have the internet and you are watching something, again, may have been the news or some other media movie you are watching online, just be careful again, not to leave any type of scenes or a page, or leave your laptop on a page where they may see something that may trigger some sort of obviously negative response. So be careful again in terms of what they're seeing or what they're exposed to in the internet. Okay, so physical activity for students with disability. I kept stressing already quite a few times around how important it is how important physical activity is for, again, our students with disabilities. Um, Physical activity plays an important role in maintaining health, well-being, and quality of life. Physical activity can help control weight and improve mental health. So again, it's, physical activity, and I'll go over these. There are a variety of physical activities that can be used, but it really helps on so many levels. If a child is stressed, again, if they're getting some level of physical activity, their focus you're shifting their focus to something that they're doing away from whatever it is possibly that may have put some level of stress or frustration on their part. Physical activity can help control weight. It does. So it's, again, it is important for us to try to maintain a healthy weight, and it is important. It is our responsibility to make sure that our children, or again, I'll kind of use the two words interchangeably, or students, basically to keep them active. Again, if they have more weight, they might feel more sluggish. Whereas, if they have a healthy weight for their own age and height and so on, then it'll be much easier, again, for them to feel better and more confident about themselves. So here is a video. It's a brief video from a physical therapist. She's just providing, again, here some general tips for physical activities that you, as a parent or as a teacher, may can use essentially to help these children again thrive in this new learning environment. It's a brief one, but I think hopefully you'll find some value in it. So here it is. I'll come back on the other side of it.
This is one of my favorite rooms. This is one of our physical therapy rooms. That's why there's all this fitness equipment in here, because our PTs work a lot on fitness. And I know it's that time of the year when everybody's thinking about fitness and getting in shape and staying healthy. You know, remember that that's a goal for our clients also. We have many issues we're dealing with our kiddos, but we also want to make sure that they're staying healthy and they're able to stay trim. They're going to have a much happier life, and that when we develop habits, that we develop healthy habits. So fitness is a topic I love to talk about, and it's an area that is great also for our kiddos that have sensory issues. Working out is a sensory modulator. So I know a lot of families that like to bike together and go on walks and hikes. These are great activities that you can do with your kiddos, even if they've got some sort of disability. Many of them are very mobile. So I would highly recommend figuring out activities that you like to do as a family. And so you can kind of hit that sensory modulation piece. You can hit that kind of bonding time together, but you can also attack the whole fitness issue. Many of our kiddos, I think we have two groups that we do here called PT Meets PT, and that's a personal trainer working with a physical therapist. And the focus of that group is fitness, and it's teaching our young adults that it's important to stay healthy and be fit and keep your body moving, and you know, strength and all of our strength and coordination in those activities improve when we're involved in fitness. So if you need suggestions on activities or fitness programs that are out there, please talk to your OT or your PT. They'll be able to give you some of that information. If you're interested in PT Meets PT, call our front office and we can tell you more about that. It's a great program that we do, and it's group fitness, which is, it's got a social component to it also. But we want to make sure we are keeping everyone physically fit.
Okay, like I said,
This is one of my
sorry,
favorite.
here, let me, I guess I'll switch over. Basically, as I was saying earlier, just went, okay. What I was saying is, I think she, you know, it was a brief video, as I've mentioned, but she touched on so many aspects and, you know, aspects of how physical activities can really help, you know, our children or students. Basically, the idea, it is really important, again, as teachers, as parents, as caregivers, to stay connected and again become a resource for to one another, so that you know you're all, so that you're aware of what other parents are doing, or what, you know, what teachers are doing. And also, she's mentioned as a physical therapist, you know, there are occupational therapists sometimes that your child or your student may require. Stay in touch with these professionals, because again, they'll help guide you through and provide some resources that you would need to help keep your children active. You know, I know sometimes, you know, unless we're very creative, sometimes we'll tend to possibly do the same things over and over, which sometimes is a good thing. But also, it's fine to try different activities and see what your children enjoy, and kind of, you know, introducing that to them more and more on a consistent basis. If they don't enjoy the physical activity, they're less likely, you know, they're less likely to engage in it. So here are some examples of physical activities. I won't go over each one of them, but again, balloon volleyball. And the reason that one is one of the first ones listed here, when I said earlier, if your children have allergies to certain materials, and such as latex, if you're going to use a volleyball or any type of ball, essentially, or anything else, just be noticed. Just, I'm sorry, just be aware and mindful of what it is that that you're using for those physical activities, if you're using anything, and be mindful of, again, of any potential allergies that they may have. to, again, certain materials, and be sure that obviously you're keeping those away from them. And again, physical activities do not necessarily always require, an object for that to take place. But however, if you are using some kind of, I guess, tool, um, please be sure that, again, that they won't have any type of allergic reaction to them. Find the puzzle piece. That's another activity. You can read together. Living room camp out. I think that's a great idea. When I was putting this presentation together, I saw that and I was like, what a great idea! Because again, most of us are confined in our house, and I think it's a very creative way. If you have a tent, you can actually use the tent right in the living room and kind of make it like present a different, I guess, scenery for them, or or environment for them to do something that's a little bit different than what they normally do, and also kind of help engage them again in different activities. And of course, if you're doing like a living room camp out, you could even have a camp out in your own backyard if you have the space actually to accommodate that. But whatever it is, obviously, remember, well, safety comes first, which I'll touch on a little bit later. But just make sure that you're doing activities that they enjoy, and also making sure that, again, you're keeping them safe, whether it has to do with allergies or anything else in your immediate area, that can potentially become I guess a safety issue for them in while conducting these activities. What else can I say? The gelatin fishbowl, set off on a scavenger hunt. Again, these are all activities, even inside a house or within the confines of your household, that you can, I guess, engage your children in. And of course, once they're active, they're doing other things, and it will help them to be able to focus better when it comes time for them to learn again from in a virtual type setting. So again, it's important also to take notice of the speed of whatever activity. So each child, again, going back to each child being an individual, you want to take care to do activities that actually obviously wouldn't harm them, but you want to allow them to do activities that will, at a certain pace that works for them. You maybe for some children they can go for longer periods of being active, whereas others they can go for maybe, I don't know, 10 minutes, 15 minutes, and that's all it takes. And, after that, they don't want to engage anymore in any type of physical activities. So just take notice of the speed. If it's something that's too fast or too slow, it depends on, again, on the child and their needs. The space that's being used, just ensuring, again, that there are no safety, potential safety issues that may come up. Equipment and or rules of play. So of course you want to kind of explain what it is, have set up, state the ground rules for it, for any type of, play or games that you may have ahead of time. And again, just these again are just some, that might seem minor in some ways, but actually would make a big difference to each child. You want to slow down the activity to accommodate students with limited mobility. And that's what I kind of mentioned earlier. Repetitions can be greater for higher levels of fitness or more mobile students. Again, the whole point is to adapt to each child and their level, the level of activity that will work for them. Like I said, for some of them, it may be that they need more stimulation, they're more active, and others are not as active, and it's okay. It's you really want to go to, according to what works for them and what will again help them to do well and do again to thrive in that environment. Reduce the duration of activities for students with lower levels of fitness. Again, individuality is, again, the common theme that we're seeing throughout, again, these activities that we're talking about. Essentially, focus on the child, him or herself, and just make sure that, again, you're meeting their needs, and that your whatever activities that you're choosing to do with them, again, remember, for you to be safe, for them to enjoy it, but also that it work, it's something that would work for them, and meet them at, their level. So that way they can really enjoy whatever it is that you've chosen. And again, they'll be in a much happier space. So be active to stay healthy at home. So obviously, a lot of these activities that I've mentioned earlier, they can be done at home or in school, yeah, potentially. But again, since we're talking about virtual activities, a lot of them can actually be done at home. But here I'm providing some specific, some other activities that can be done at home, um, that can mainly be done at home. Is what I'm trying to say. So basically, you want to decide how much physical activity is right for your child and his fitness level, and then pick an activity they enjoy. So again, those were areas that I've stressed early on. Gardening, doing chores around the house, particularly in Florida. I know depending on different parts of Florida, the weather patterns may change, but gardening is actually something fun that they can do. Again, as long as it remains something safe. And if they enjoy it, that's a good activity to engage them in. Doing chores around the house, wheeling themselves around in their wheelchair, walking briskly, dancing. Include your favorite physical activity into their daily lives. Again, just pick and choose activities, maybe introduce new ones, but again, and see how they adapt, and how much they enjoy it. If not, if there's something that if there's an activity that you've selected for them to do, and they don't like it, don't force them. So, try something else. Again, you want them to be an active, obviously, part of these activities, if I can say that. So participation in physical activity. The physical therapist earlier said that, again, it's important for them to remain active. But also, again, it helps on so many different levels. It helps them with their mental health. It helps them with their confidence. It helps them to be social, because again, they have either they have either the teachers present or parents present. Again, that's time that you're spending with them. That hope, again, the idea is to help, is for them not to be isolated, but to the time that you're spending with them, that they're actually enjoying, again, the time that they're spending with you, and that they're not feeling isolated and alone, and with not very much to do. So it's important to always spend as much time as you can, but at least the time that you can, not so much how long that you're spending with them, but in the amount of time that you're choosing to spend with them, that it's quality, that it's something, again, that they enjoy, and that is safe. So speaking of safe, we have those 5-step plan. Again, when you're thinking of different activities to engage the students in, or the children in, first and foremost is safety. And I stress that quite a bit. As important as it is for them to remain active, but we want them to be safe. So before engaging them in any type of activity, once again, please look around, make sure that there's nothing that can be harmful to them. Also, like I alluded to, or I actually discussed about certain types of allergies they may have. So just keep these things in mind, so that whatever it is that you're choosing to do with them, that their safety really comes first. Integration of wellness. Again, once they are active, it helps them, like, yeah, as stated earlier, with any type of mental health, whether they're stressed, they're frustrated, or sometimes even a lack, their lack of sleep. Um, all of this, if they're active enough, that's basically some way that you're integrating wellness into their lives. That's not the only way, and I'll bring in the nutrition element later. However, in terms of physical activity, and of course nutrition, just really try to keep them, to engage them in activities that will promote their well-being. Make the connection. So again, just making sure that they are, that again, that they're connected with others, whether again it's through social. When I say social media, I'm thinking more of Zoom and other I guess FaceTime is another one, and many other ways that they can engage and keep and engage with others, and so that you can add that social element to their daily lives. Increase participation and promote healthy lifestyles. Again, we want them to be involved in those activities. They're for them. So whatever it is that you think that they like or enjoy, um, by all means, you use these over and over again, and that way you'll keep, not only they'll be engaged in these activities, but you'll increase their likelihood to participate and again be part of these activities. So what are some of the benefits of physical activities? Again, I've stated those a few times, but there are some others here. Improve physical fitness, reduction of disease risk, skill development, which is not one that I've really touched on earlier. But again, maybe it's putting together puzzles or whatever it is. So they're developing other skills through, again, different types of physical activities that they're engaged in. Socialization, because these activities, they're doing them either with a teacher or with their parents or other caregivers or family members. Social emotional well-being, greater confidence, which I've mentioned earlier, decreased body fat. Again, we want our children to be as healthy as possible. So again, we're wanting to give them all of the tools in order for them to maintain good health. Greater attention. Um, Sometimes it's again, just to have a child, or I'll say generally even adults, sometimes when you want to be focused on something and you're losing your level of focus, one of the things you would do is possibly, well, something that you can do is to just go for a walk or run or whatever other activity. And once basically, so it's what I'm trying to say here is to do the same for those students. So, engage them in some physical activity where they can, like, have all of their energies and everything else focused on something that's fun that they've enjoyed. And then now when it's time to learn, or when it's time for them to do something that requires much more focus, then they'll be able to focus on that specific activity, whether it be learning or something else that you're trying to engage them in or teach them. Manage progression of chronic disease and functional decline, mediate the psychological and social impact of disability, increase independence, which is very important for them to be able to feel like they're basically that they're feeling confident in being independent and doing certain tasks on their own. Facilitate life skill competencies, improve overall inclusion in family community life, and enhance socialization. So again, these are all the benefits of physical activity. So there are many. So nutrition for children with disabilities. Well, I know that their nutrition, again, I guess it's mostly home focused these days because of, again, of the virtual learning environment. but nutrition is extremely important. Um, I've listed here the top 10 diets for children with disabilities. All of them, or each of them, are geared towards children with very specific disabilities. I'm not going to go over each one of them, but I'll just pick a couple of them, for instance, basically to go over with you. So gluten-free diet. A gluten-free diet essentially helps if you have children. Many times children with Down syndrome, they have they may have a how would I say this? They may not be able to digest foods that have gluten in it. So certain foods such as wheat, barley, oats may not be the best types of food to have them because of the gluten, because they contain gluten. So what I guess through studies that have been conducted, there's been more evidence, I guess, to suggest that children with Down syndrome, for instance, giving them a diet that is, free of gluten will actually help them, again, to do better, or to do better in their day-to-day activities. So I know, again, because well, even though we've now slowed down tremendously over the past year, but sometimes because of we're very active and we have so many things to do, when it comes to food, generally we can just pick up something quickly at the nearby fast food restaurant, or else a restaurant. But be mindful of the type of nutrition, or the type of diet, I'll say, that would be more conducive to helping your child thrive. There's also the ketogenic diet, which is now extremely popular over the past, I don't know, 5, 6 years, if not a little bit longer. But originally, the ketogenic diet was, well, done correctly. It's been very commercialized lately. But I guess I'll say the true ketogenic diet basically helps children with seizure disorders, epilepsy. There are many other types of, I guess, syndromes or diseases that the ketogenic diet, again, where studies have been conducted and there can see improvement in these children's lives based on this specific type of diet. So if you have children with seizures or epilepsy and other similar type diseases or illnesses, again, look at the diet that they currently have, and see if if by changing the diet, if that can really help them. And just take notice. I know it may take a little bit more time on our side as parents, to prepare meals and so on. However, again, nutrition is something that we don't always necessarily focus on, but it is an important component to add to our children's lives, and that will really help them. So again, there are each one of these different types of diets offer different benefits to different children, to children with different disabilities. So I would highly recommend that, again, that you look into nutrition as a way to help your children, again, do better, develop better, and hopefully, again, you know, basically maintaining their health. So these are some resources. A lot of this information I've captured from some of these resources. Of course, health.gov has a lot of information and physical activities. Action for Healthy Kids is another website. And then Child's Development Milestones with CDC's free milestone tracker app. So again, these are some tools and I guess resources that you can use or at least refer to for more guidance and more again resources that may help you with your child. There are additional ones here. The CDC for sure is one that I kind of always go to because there's a wealth of information there. But there are others also, such as the NCH pad, which is where they have inclusive physical education, disability awareness, which is one of the sites again that I've that I've gone through as I was putting those slides together, and they had a tremendous amount of resources and information that can help you and your children, again, as far as promoting well-being, their well-being. So these are some other scholarly references that I've listed here for you. Among them, there's the Florida Department of Education, and their specific website is listed here. So I would recommend that you take a look. Again, the information can be overwhelming. So what I would really advise is for you to um, be focused more or less on what you're looking for and go through these resources, because there's a lot of information out there that is useful, and can be obviously useful to you in, again, helping your children or students thrive in this new learning environment. And those are some other references. Please, again, there are many others that I can share with you if you'd like, but please go through them. And depending on what you're looking for, there's so much information out there that I would really recommend that you go through them, but be focused when you're researching a particular subject, because then you can really get lost with the information the amount of information that's out there for our children. So with that, I want to say thank you.